Hi, everybody. My name is Gertrude, and for the substance abuse presentation, I'll be discussing methamphetamine. Methamphetamine, commonly known as meth crystal or ice, is a powerful central nervous system stimulant with high potential for addiction and abuse, according to National Institute on Drug Abuse 2024. It increases dopamine level in the brain, resulting in intense euphoria, increased energy, and hyperactivity, making it highly addictive. The history of abuse. Methamphetamine was developed in the early 20th centuries during the World War to help keep soldiers awake. And its abuse roots from the post-World War when it was widely used for weight loss and depression. Um, it became normalized in the civilian and military population due to its stimulating effect. Through the 1950s and 1960s, amphetamine consumption surged high due to aggressive marketing and expanded medical indication, leading to widespread dependency. So, despite the introduction of alternate treatments and the restriction placed on amphetamine in the 1970s, amphetamine continued to be widely prescribed. Illicit production and distribution continued to rise, contributing to the drug's abuse and the recognition of its addictive potential, setting the stage for the methamphetamine abuse crisis seen today. Prevalence and epidemiology in the US. According to the National Survey on Drug Use and Health 2022, approximately 2.5 million people in the US reported using amphetamine in the past year, with the highest rate among adults between the age of 26 and 49. Methamphetamine use has significantly increased in rural and urban communities, contributing to rising overdose deaths. The risk factors include a history of trauma, mental health disorder, poverty, homelessness, and living in communities with high meth availability. Vulnerable populations include adolescents, individuals with co-occurring mental health diseases, and those with a family history of substance abuse. The short-term side effects of methamphetamine includes increased wakefulness, decreased appetite, rapid heart rate, hypothermia, and euphoria, while the long-term effects include severe dental issues called meth mouth, cognitive impairment, memory loss, anxiety, psychosis, weight loss, and cardiac problems. Signs and symptoms of abuse upon assessments for a patient using methamphetamine would include agitation, paranoia, rapid speech. You would notice dilated pupils, poor hygiene, dental decay, skin sores from their picking the skin, insomnia, and weight loss. Behavioral signs include compulsive behaviors, aggression, and social withdrawal. Potential for overdose or use as suicidal weapon. Methamphetamine overdose can result in hypothermia, seizures, cardiac arrhythmias, stroke, and death. High doses can be used in suicide attempts due to its potential for cardiac collapse and multi-organ failure. Pharmacological treatment for methamphetamine. Currently, there is no FDA approved medication for methamphetamine use disorder. However, bupropion and naltrexone can be used off-label or have shown potential benefits. Non-pharmacological treatments such as CBT, that's cognitive behavioral therapy, contingency management, and motivational interviewing are evidence-based intervention used to treat methamphetamine. according to the National Institute on Drug Abuse 2024. Patients are educated on the risk of meth use, potential for relapse, harm reduction strategies, and the importance of adherence to treatment. Referrals are made to specialized substance use treatment programs and support groups such as Narcotic Anonymous for ongoing recovery support. Regular follow-up visits are scheduled to monitor progress, assess for relapse, address co-occurring mental health conditions, and provide ongoing therapy. In conclusion, methamphetamine abuse remains a significant public health issue in the United States, impacting individuals, families, and communities. Effective management includes early identification, evidence-based therapy, patient education, and multidisciplinary collaboration to support health, long-term recovery, and prevent relapse. Please see attached note for references. Thank you.